Okay, now joining me today is Dr. Hector Georgiou, one of the leading experts taking part in a very special community event hosted by the Hellenic Medical Society of Australia and the Greek Community of Melbourne. And it's all about understanding your body, your fertility, and your path to family. This event will take place on Sunday, November the 9th at Cafe Greco in Oakley, and it's completely free to attend. It's actually going to be upstairs at the Apollo Room. And as I said, the event is for free. How are you, Hector?
Hi, good evening. I'm very well, thank you. How are you? Thanks for having me on your show.
Thank you for being so patient. It's been a huge show tonight and one after the other. And sometimes you just don't know how long a guest will be on for. So my apologies. I know you're a very busy person, but
No
thank you so
stress.
much. So I know you're very busy and we'll get through very quickly what I want to get through for our audience. Now, Dr. Georgiou, for many people, fertility is something we don't think about until later in life. But why is it important to understand it early, whether you're planning a family now or not?
I think we all in school get taught about, how to go about preventing a pregnancy at a time when we're not ready for it. But I don't think we focus so much about pregnancy when we do want it. And human biology is harsh, if I'm honest with you. And the older we get, it's not that it's not possible, but that it is harder. So I think if we're proactive in thinking about fertility, then that gives us all the options for now or for the future.
Thank you so much. The session is for both men and women, the upcoming session, November the 9th, which I think is fantastic. Can you explain why fertility isn't just a woman's issue and how men's health plays a role too?
Absolutely. So the event, as you very kindly mentioned, is on the 9th of November, and it is open to all, so both genders and people of all ages. And it's important to recognize that, yes, fertility is not a problem that just affects women. It's a 50-50 thing. And yes, we do focus on female fertility because the decline with age is more steep. But increasingly, we understand that male fertility also declines with age. And also older fathers not only have lower counts of sperm, but children born from older fathers have been shown to have a slightly increased risk of diseases, including autism.
Wow. I didn't really know that at all. Yeah, that's an eye opener for me and kind of threw me out a little bit there. I didn't realize that, if the father is an older person and older in age, it's come now that there's that risk of autism in a child. Is that right?
That's right. It's not a guarantee, of course, and we know
But
that autism is a spectrum
possibility.
of disorder which has many management options. But yes, absolutely. Above age 45, in the case of men, we have found in multiple studies this increased link with autism spectrum disorder.
Thank you for sharing. Now, you're part of a panel that's taking a holistic approach to fertility. What does that mean exactly, and why is it important to look beyond just the medical side?
Yes, I'm so proud to be joined by 4 expert colleagues in the field who come at fertility from slightly different angles. So apart from myself that deals with sort of the fertility treatment from a medical point of view, I'm joined by a colleague who is a dietitian who specifically specializes in people who are interested in optimizing their fertility. I'm joined by a perinatal psychiatrist who supports individuals and couples who are going through pregnancies and fertility troubles from a mental health point of view. And in addition, 2 general practice colleagues who, of course, will be the first port of call and answer a lot of the basic questions that people might have right at the outset, and also facilitate initial testing and onward referral to a specialist when the timing is right, because it's important to obviously prevent having to see me if it can be helped.
Yeah. Look, everybody knows that when you're trying to start a family or when you're facing challenges with fertility, it can be a very emotional journey for many. How can couples or individuals look after their mental well-being during that process?
I think that's really important, and there's no one size fits all. But first of all, communication within the relationship is key. And whether then you share that with the people around you is not something that everyone feels comfortable to do, but some people, of course, can tap into that. It's also really important to bear in mind that you're not alone. There's many people that are going through this. 1 in 6 couples are troubled with infertility. So it is extremely common. We might not be speaking about it openly, but it is extremely common. As part of fertility treatment, we always offer supportive counseling to everyone that goes through treatment. So there is also professional help that is available when you take that step to speak to a specialist.
I want to touch on myths and misconceptions because there's still a lot of stigma and misinformation around fertility, especially in many cultural communities. What are some of the biggest myths you'd like to clear up?
Firstly, something that we touched on already, that fertility is a woman's problem.
That's right.
I think it's really important that we normalize the fact that it takes, biologically speaking, 2 people to have a baby, and sometimes patients that come to see me come without the male partner, and sometimes, of course, it's for good reason due to work-related commitments, but I do want to see both partners because it does take 2 people. So that's the first thing. The second thing is to say that, if I'm older, I can't have a baby. I think people have that fear, which is not true. You absolutely can have a baby when you're older, but we have to acknowledge that it is a more difficult process. And that's why this event, I feel, is so important, because if we raise awareness and we are more proactive, it doesn't mean have a baby younger, because that's easier said than done. But, explore options like egg freezing, for example, that can in the future make having that baby when you're at the right point in your life much
I
easier.
guess you kind of answered the next thing I want to touch on, because for those listening who might be curious but unsure, what are some of the early signs or steps people can take to check their fertility health or optimize it? I know you've sort of answered it.
So really important steps, generally speaking, at any point in your life is to, all the things that feed into fertility are optimized. So that's the healthy Mediterranean diet, quitting bad habits, easy to say, of course, but that means no smoking, no heavy drinking, no recreational drugs, of course. So these things are very important. Other conditions that people might be affected by, particularly if they're hormone related, thyroid issues, diabetes. So keeping those under good control is also really important from a fertility standpoint. But if you want to assess your fertility and you're at a point where you're not able to have children because of other things going in your life, then what I would recommend is to see a fertility specialist who can do those specialists blood tests and scans for a woman, or sperm analysis for a man, just to see where things are at now, get a picture of what things are looking at now, and then make a plan of, what you would like to do in the future.
Thank you. Now, finally, what can people expect from this event, this session, and why should they come along on November the 9th?
So it's going to be a really relaxed event, with tea or coffee, of course. And myself and my co-panelists essentially are going to ask questions that I think are playing on everybody's mind, covering all our different areas of expertise. And then we will be very open to take any questions, either on a sort of to the side in private or during the whole session. We just wanted to be a warm and inclusive event where people are very welcome to join in and hopefully take away some helpful information. I think it's really important that we all realize that infertility is really common. There's no shame in it. And also there's different paths to starting your family, conventional and perhaps less conventional. And it's really important that we talk about it and normalize it.
Dr. Hector, thank you so, so much. And I look forward to seeing you on November the 9th. And on our screens, we do have the barcode. I'll leave that on for a little while, where you can click on that barcode and get your tickets for November the 9th. Dr. Hector Georgiou, thank you so much for your time today.
Thank you. See you on the 9th.
See you on the 9th. And that was Dr. Hector Georgiou joining us ahead of the Understanding Your Body, Fertility and Parts, a family event, which is happening on Sunday, November the 9th, upstairs from Cafe Greco in Oakley. It's free to attend. The spots are limited, so make sure you book early. And for more information, head to the Greek Community of Melbourne or the Hellenic Medical Society of Australia pages or the KK Factor, because you don't want to miss this one.